In this video, we will walk through the contents of a VOP chemotherapy shipment. Every VOP shipment is clearly labeled as to whether or not its contents need to be refrigerated. If you see a perishable label, please open the box immediately and refrigerate your patient's dose appropriately. Upon opening the box, one of the first things you will see is a patient document sleeve. Inside the sleeve, you will find a copy of the patient's most recent consult report, administration protocol for that specific drug, a client handout for at-home care to be sent home after the chemotherapy has been given to the pet, and a technician recheck form which will be used to gather information at the patient's next appointment. Each box will also contain a bag with a saline flush and all administration supplies necessary for the administration of this patient's chemotherapy dose. This kit should be saved for use at the time of chemotherapy administration. Next, you will find a bag of appropriate personal protective equipment, including masks, gloves, and gowns for 2 team members, as well as a chemotherapy administration pad. Each team member should double glove when administering chemotherapy. This bag should also be kept. The final item included in your VOP box is an insulated sleeve that contains the patient's customized chemotherapy drug dose, which is located inside a plastic chemotherapy transport bag. Remove this bag from the sleeve and ensure that the patient information sticker on the exterior insulated sleeve matches the patient information sticker on the chemotherapy transport bag. Flip the chemotherapy transport bag over and locate the temperature monitoring card. You do not need to open the bag to locate this card. Please read this information carefully and ensure that the time strip monitoring device shows that the patient's dose has been kept at a proper temperature throughout transport. At this time, place the chemo transport bag into a refrigerator, and the remainder of the contents of this box should be saved and placed somewhere in the hospital to use for this patient at the time of chemotherapy administration.